Hi friends, I am Dr. B.B. Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.in and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary. For the medical knowledge to general people and for reference to medicals. Today I am going to discuss about the diseases of pleura, pleurisy and effusion. Diseases of the pleura may be either pleurisy or pleural effusion. Inflammation of pleura may be either type, dry or plastic type, and is seen with parenchymal disease of the lung like pneumonia, pulmonary suppurative disease, etc. Dry pleurisy. Dry pleurisy is less common in children. Clinical features: dullness and diminished breath sounds, pleural rub may be present. Fever. Acute dry pleurisy manifests with fever and sharp pain in the chest or shoulder in the affected side or abdomen. Cough. Cough, suppressed respiration and a grunt may be present. Pleural rub. Clinically, the pathognomonic sign is the pleural rub, to and fro friction of the grunting sound. Other symptoms may be that of the underlying disease like pneumonia, epidemic pleurodynia, Bornholm disease due to coccical virus. The chronic type of the disease is due to the tuberculosis, rheumatic fever, pulmonary suppuration and uremia. Treatment. The main objects of the treatment are to alleviate the pain and to treat any underlying disease that may be present. Pleural effusion. Pleural effusion is the collection of the fluid in the pleural cavity, and the effusion depends upon the disease involved. It is less common in infants and small children. Clinical features. Small effusions rarely produce any symptoms or signs but is detected by X-ray findings. Large effusions may cause symptoms of respiratory distress, pain in the chest and fever. The nature of the fluid in the pleural cavity may be a transudate, exudate, serous, sanguinous, purulent or chylous. The commonest cause of the effusion is almost always the tuberculosis in India. Hemothorax may be due to trauma or malignant condition. Chylothorax is due to injury to the thoracic duct or filariasis. Purulent effusion is due to various infections. Causes: pain in the chest, dyspnea and fever. The involved side moves less with respiration. There is a bulging of the intercostal space and a flat percussion note. On auscultation, the breath sounds may be absent. In large effusions, the shift of the mediastinum may be obvious. The trachea and apex beat are shifted to the healthy side. Diagnosis: established by impaired percussion note, bronchial breath sounds and bronchophony. May be elicited by fluid, perhaps due to compression of the lung tissue by effusion. X-ray of the chest may be helpful to confirm the diagnosis. At least 300 ml of pleural fluid must be present for demonstrable skiagram. The skiagram shows a homogeneous density on the involved side with the shift of the mediastinum to the healthy side. Lateral decubitus films may also help to bring out the mobility of the fluid shadows. Sometimes the fluid may be present in loculated areas or along the interlobular fissures. Diagnosis: TAP and thoracocentesis. establish the diagnosis but also ensures the nature of the fluid by providing the samples for various studies of fluid like protein, cells, cell smear, etc. Smear and culture and sensitivity are indicated to detect tuberculosis, fungal infection, or malignancy. Pleural biopsy. The biopsy with Abraham's needle is an useful adjunct in cases where the diagnosis has not been established. Treatment. The treatment is directed towards the relief of the respiratory distress by means of removal of the fluid collection by thoracocentesis. Inflammatory exudates have to be removed in order to prevent adhesions, pleural thickening, and promote proper re-expansion of the diseased lung. Appropriate treatment is employed for the associated underlying disease. That's all about the diseases of the pleurisy and pleural effusion. And in the next video, I will discuss about some other disease. Thank you.